Your name? Mushraf, your group number? Okay, please click by procedures and manipulations. Okay, down.
Scroll down.
Down.
Still down.
Again, procedures and manipulation.
Down.
Down. Okay, blood sampling.
Third one.
Training.
Start.
Training. Okay.
Yeah, sit.
What process should be the following?
Read. Down.
Read. Mushraf, read.
What branch?
Reading.
Read 4 options down.
Come,
Read.
Introduce yourself. Ask the patient's name and date of birth. What process should be the following?
Mushraf, read.
Assembling the vacuum system. Like read aloud.
Assembling the vacuum system, hand treatment with antiseptic, remove
High
the
volume.
film,
High. Increase.
put a pillow under your arm.
Treat your hands with antiseptic. What process should be the following?
Choosing the patient position, preparing the paving, apply a tourniquet, making sure the patient is in good health.
Ask the patient to sit or lie down in a comfortable position. What process should be the following?
Put the pillow under your arm, remove the cap from the needle, ask the patient to make a fist, put on the gloves.
Before clicking, reading again. What do you choose?
Put the pillow under your arm.
Okay.
Under the patient's arm, place a rubber cushion. What process should be the following?
Put on gloves, assembling the vacuum system, apply an alcohol wipe to the venipuncture site, apply a tourniquet, put on gloves.
Wear gloves. What process should be the following?
Apply a pressure dressing, preparing the paving, ask the patient to take a deep breath, choice of venipuncture site.
Prepare the paving.
Prepare test tubes corresponding to the test kit. Red, yellow, blue color indicators. 3 alcohol and sterile gauze wipes, plaster, bandage. What process should be the following?
Vein puncture, labeling of test tubes, remove the vacuum system from the vein, needle selection.
Select the appropriate size needle. Make sure the label on the needle is intact. What process should be the following?
Make sure the patient is in good health, examine the venipuncture site, loosen the tourniquet, unclench your fist, apply a pressure dressing.
Examine the site of the proposed puncture. Is it possible to inject without a tourniquet? Presence of skin rashes. What process should be the following?
Vein puncture, fixation of vein with the finger, assembling the vacuum system, apply a tourniquet.
Place a tourniquet 10 to 15 centimeters above the intended puncture site on a sleeve or disposable napkin. What process should be the following?
Treatment of the venipuncture site, ask the patient to make a fist, fixation of vein with the finger, apply an alcohol wipe to the venipuncture site.
Ask the patient to make a fist. What process should be the following?
Apply an alcohol wipe to the venipuncture site, make sure the patient is in good health, choice of venipuncture site, insert the tube into the needle holder.
Select the puncture site by palpation. What process should be the following?
Make sure the patient is in good health, labeling of test tubes, treatment of the venipuncture site, fixation of vein with the finger.
Treat the puncture area with an alcohol wipe. Wait for the alcohol to evaporate. What process should be the following?
Remove the tube from the holder, assembling the vacuum system. Loosen the tourniquet, unclutch your fist, fixation of vein with the fingers. Assemble.
Assemble the vacuum system. Screw the needle into the needle holder. What process should be the following?
Remove the tube from the holder, make a few wiggling movements with the tube. Make sure the patient is in good health. Remove the cap from the needle.
Remove the protective cap from the free side of the needle. What process should be the following?
Insert the tube into the needle holder, remove the tube from the holder. Loosen the tourniquet, unclutch your fist, fixation of vein with the fingers.
Fixation.
Fix the vein by pulling on the patient's skin. What process should be the following?
Vein puncturing, labeling of test tubes, remove the tube from the holder. Ask the patient to take a deep breath.
Ask the patient.
Ask the patient to take a deep breath. What process should be the following?
Loosen the tourniquet, unclutch your fist, remove the vacuum system from the vein puncture, apply an alcohol wipe to the vein
Vein
puncture.
puncture.
Continuing to fix the vein, gently puncture it until you feel a hit in the void. What process should be the following?
Apply an alcohol wipe to the vein puncture site. Insert the tube into the needle holder. Remove the tube from the holder. Make a few wiggling movements with the tube.
Tube.
Insert the tube into the needle holder as far as it will go. What process should be the following?
Remove the tube from the holder. Loosen the tourniquet, unclutch your fist. Apply an alcohol wipe to the vein puncture site. Make a few wiggling movements with the tube.
As soon as blood begins to flow into the tube, loosen or remove the tourniquet. Make sure the patient has unclenched his fist. What process should be the following?
Remove the tube from the holder. Apply an alcohol wipe to the vein puncture site. Make sure the patient is in good health. Labeling of test tubes.
After the blood flow has stopped, remove the tube from the holder, leaving the needle holder system in the vein. What process should be the following?
Remove the vacuum system from the vein. Make sure that patient is in good health. Apply a pressure dressing. Make a few wiggling movements with the tube.
After removing the tube, make a few jiggling movements. What process should be the following?
Labeling of test tube. Make sure that patient is in good health. Remove the vacuum system from the vein. Apply an alcohol wipe to the vein puncture site.
Apply alcohol.
Apply an alcohol wipe to the puncture site. What process should be the following?
Remove the vacuum system from the vein. Apply a pressure dressing. Make sure the patient is in good health. Labeling of test tube.
After the last tube is filled, remove the needle holder from the vein. What process should be the following?
Apply a pressure dressing. Labeling of test tubes. Make sure that patient is in good health.
Remove the alcohol wipe from the puncture site and apply pressure dressing. What process should be the following?
Labeling of test tube. Make sure the patient is in good health.
Make sure the patient is in good health. What process should be the following?
Looking at the
Label all blood sample tubes.
completed.
Scenario completed.
Okay. You like it? Yes. We understand it? Okay.